we start this session about sudden illness. The objective for this session, we will define sudden illness, and we will concentrate on fainting and diabetic emergency, determine what to look for and when to call 999 or local emergency number, and what to do until they arrive. When caring with patients with sudden illness, we have to start with fainting first. So fainting, it is a temporary loss of consciousness. When someone is suddenly loses his consciousness and then he reawakes. So it is occur when there is insufficient blood supply to the brain and for a short period of time. This condition results from widening of blood vessels, dilatation of blood vessels in the body, and this will cause that the blood will drain away from the brain to the body. What to look for in that person? So a person is about to faint often because become pale and begin to sweat and lose his consciousness and collapse. Feeling weak or dizzy. This may be prevented by lying the person down or sitting, and when this condition and when the head level be below the knee level, in this case, he might regain his consciousness. So we can lie him down and elevate his legs. Unless if there is hip injury, we cannot do that. When to call the local emergency number? It is always appropriate to seek medical help in case of fainting and call the local emergency number. What you have to do until they arrive? We have to help the person to lie down, so lower the person to the ground and put him in a flat surface, position him or her on his back and let him lie flat, lose any tight clothes, especially at the neck, and check the person breathing. If he is breathing well, we can also put him in recovery position, especially if we feel that he wants to vomit. Do not give the person anything to eat or to drink. In case of fainting, it is associated with decrease of blood flow to the brain. It might be due to many conditions. It might be due to low blood sugar. It might be due to fatigue, anxiety, dehydration, some kind of anemia, frightening, drugs, arrhythmia, heat exhaustion, bleeding. All of those conditions might lead to loss of consciousness and fainting. Fainting may also due to sitting or lying for a long period of time. So when you wake up, when you want to stand suddenly, in this case, you might feel dizzy and you might feel that you are going to fall. Fainting, what to do, what to look for in fainting? Dizziness will be there, weakness also, seeking, sometimes seeing spots around you, blurred vision, ringing of the ear, nausea, pale skin, sweating. All of those are signs of fainting. What to do in case of fainting? We should not splash the person's face with water or slap him or using smelling salt. Prevent from falling. We can prevent him from falling down by lying him down and elevate his leg. Lose the tight clothes, as we said before, and provide fresh air. So we can prevent if crowded are around that client, we can take him away from that crowd. Provide cool, sweet drink if the client is able to swallow. Usually, in case of fainting, usually it is not serious. We have to call for help if the client is over 40, if repeated attack, especially in case of seizure or epilepsy, if he does not awake within 5 minutes, if he loses his consciousness while he is lying down or sitting. Seizure or epilepsy, it is a abnormal situation of the brain cell, which called epilepsy. It might be due to epilepsy itself, it might be due to poisoning sometime, that convulsion, it might be due to the epilepsy, the poisoning, the hypoglycemia, brain injury, drug withdrawal, overdose of drug sometime, heat stroke, electrical shock, high fever. So all of those cases, it might lead to a convulsion. What to do in case of convulsion or seizure? So we have to cushion and prevent the head from getting injury, lose tight clothes, look for medical alert or tag. Some of the clients, they might have a tag or that show that they are having a chronic illness like seizure or diabetes or whatever they have. We have to tell the client to assign at the end of seizure. Do not put anything in the client's mouth in case of when convulsion is there. When to call for medical help in case of seizure or epilepsy? If the epilepsy is for the first time, so in this case we have to seek medical help. If the seizure lasts more than 5 minutes, if the victim has multiple seizures, recurrently he is awake and then another attack of seizure is coming again. If the victim appears to be injured, if the victim is pregnant or diabetic. Another cause of fainting, which is hyperventilation. What to do in this case? We have to calm the client, reassure him, let him inhale through his nose and exhale through his mouth. Don't use the paper bag for it. Diabetic emergency, it is related to the insulin is lacking or ineffective insulin in the body. The insulin, it is produced by the pancreas, by the islands of Langerhans in the pancreas. So it is a hormone produced by that gland. It helps the body to use the energy and sugar from the blood and regulate the blood from between tissues and the blood. Diabetes also, it has two types, type 1 and type 2. Type 1, which is called the juvenile diabetes mellitus or insulin dependent diabetes, which is mostly affecting children, but also it might affect old age. The type 2 adult onset diabetes mellitus, it is related mostly to the diet control and related to overweight. In this case, it can be regulated by the diet. In hypoglycemia, or the blood sugar is low, which is called hypoglycemia, this has happened if the client took his insulin dose and he did not take food. So high level of insulin and low level of food. So in this case, hypoglycemia will be there. Or if the client is not taking food. So in this case, the blood sugar, it will come down. What are the signs and symptoms of low blood sugar? Signs of low blood sugar, it is suddenly happens sometime. The patient or the client will have bad temper, pale skin and cold skin, and the skin will be also moist. Confusion will be there, hunger, change of level of consciousness will be there. We have to concentrate on the pale, cold, moist skin. It is mostly the sign of low blood sugar, which differentiated from the high blood sugar. Low blood sugar, what to do in this case? We can give sugar, we can give any candy or fruit juice, but we should not give the diet soft drink. We have to activate the medical support system or emergency system if no improvement within 15 minutes. In case of high blood sugar or hyperglycemia, it's happened when the blood sugar is becoming high if the patient is taking his diet and he did not took enough insulin, dose of insulin, or he did not took insulin, or he is taking some sweet. High blood sugar, the signs and symptoms for that is gradually onset, drowsiness will be there, thirst will be there, frequent urination, flushed face, moist and hot skin. In hypoglycemia it was moist and cold skin, but here it is moist and hot skin. Vomiting might be there, fruity breathing odor or acetone smell. Also, this will not be associated with hypoglycemia. It is only an hyperglycemia due to change of or losing the fat to produce energy. This will produce ketone body in the body, and this will give the smell of acetone to our breathing of that man. Also, it might lead to loss of consciousness. High blood sugar, what to do in this case? If not sure, is it high or low blood sugar? But nowadays, maybe every house, they are having that reflex check machines, and it is better to check his blood sugar if that machine is available. So we can give fruit juice if the patient is conscious, or we can give candy for him. If he did not improve within 15 minutes, we have to transfer him to the hospital. If we are sure that it is a hyperglycemia, we should not give at all any type of sugar or juice. We can help him in taking his insulin dose if he did not take his insulin dose, and transfer him anyway to the hospital.